Good afternoon. Welcome to We Care Wednesday. My name is Wendy Lee. I'm one of the compounding pharmacists here at Hawthorne Pharmacy on Taylor Street. Today I'm going to talk to you about hormone saliva testing. As many of you know, we conduct private hormone consultations with patients and then work with their current healthcare providers to come up with a plan to help you with any hormone imbalances you may have. What are hormone imbalances? Hormone imbalances, we're mostly looking at what we call the sex hormones, which are estrogen, progesterone, testosterone, and cortisol. But a lot of people are like, well, how do I know if I need hormones? Well, we now can test it to see if you actually have a hormone imbalance. So the first step in our consultation process is to test. And what you do is you actually spit into a test tube, which sounds very weird, but we find this is actually the most accurate measure of hormones today. So this is what we call a saliva test. We actually have these here at our Taylor Street location and our West Columbia location. If you need one at any of our other Hawthorne pharmacies, just give us a call. We can definitely help you out with a test. But there's two little test tubes. There's a morning tube and a nighttime tube. In the morning, you do that first thing when you get up in the morning. You rinse your mouth out with water and then you start basically spitting into the test tube. You want to get it as full as possible. After you're done with your morning tube, there's actually little labels. You can put your name on it. And then the nighttime tube you do right before you go to bed. So there's two tubes in here. This test actually will check 13 different hormone levels. It checks 3 different estrogens, estradiol, estriol, and estrone. Checks progesterone, which is a calming hormone. Checks testosterone, which a lot of the men are very concerned about, and women. So this is one we definitely check. Also, we check cortisol, which is a stress hormone. So if you're under a lot of stress, cortisol levels can become out of balance. Melatonin, which is a sleep hormone. And it also checks some other metabolites to make sure that your hormones are converting correctly in your body. So with this test is for both men and women. Men can actually do it at any time. Women that are postmenopausal can do it at any time. Women that are still having cycles have to do it at certain times of the month. So definitely call us if you have questions about when to test. Also, if you're on hormone replacement, if you're using a cream, if you're using patches, if you're using tablets or capsules, there's certain times that you want to make sure you're doing it correctly, or we can get a false reading. With majority of our patients, I would say, are on topical hormones, and with topical hormones, you want to be off of the topical form for 24 to 48 hours only. After 48 hours, if you test too late, your test may come back too low, or if you test too early, your test can come back too high. So it's definitely, we want to make sure you do the test correctly to get the right levels. After you do the test, you actually, there is paperwork that has to be filled out in the test. This is the form that we have. You want to make sure you fill it out completely, put your name, address, phone number so we can contact you after the test comes back. Also, the tests are already pre-selected, so we already have that picked. And then you just sign and date the bottom. Then you put this form back into your box, the box where the test is, and obviously put your specimens in there. And then you mail it UPS, not USPS, not FedEx, but it would have to be UPS or they won't get the test. But it goes back to UPS in a prepaid mailing envelope. So you just drop it off in one of the brown UPS boxes. How long does a test take to get back? Usually about 10 business days, depending on holidays. That kind of can sometimes throw a little delay into it, but usually at about 10 business days, and then we'll contact you to let you know the test results have come in. If the test does show an imbalance, a lot of times we'll recommend doing a consultation where we can come up with a plan and work with your doctor. If your test looks great, we can just mail it directly to you. So that's a little bit about hormone saliva testing. If you have any questions at all, please feel free to reach out to us here at the Compounding Lab. Our phone number is 803-227-4452. I want to thank you for watching We Care Wednesday today with me. And I hope you and your family stay healthy today. Have a fantastic Wednesday. You take care.